Today we brought together a range of representatives from the private sector through to medical directors and frontline staff to discuss how innovation and procurement can improve patient safety across the spectrum. It was a very lively discussion with lots of topics covered. Key theme that came through was the need to build relationships and build trust from staff at the front line to directors in trust right across to the innovators in the public sector.
We're absolutely not there yet, and there's much more we could do, particularly around standardisation of products based on outcomes, demonstrable outcomes. And one of the concerns I have is because of the financial squeeze, cost and price is what's driving decisions, and that's not necessarily linked to audit and outcomes, both in terms of the patient's pathway and the overall health improvement in patients' lives.
And so there's something about the whole procurement pathway that doesn't lead to a partnership or collaboration right from the start. And I think, if anything, there's now less trust and more suspicion in the system than there was sort of 5-10 years ago, when the systems weren't quite so tight.
You might be changing your suture material supply so that somebody's got very used to the tactile sensation of tying particular knots with particular sutures, and if that shifts, trying to map the downstream impact of some of that is quite difficult and often not listened to. Because it's felt to be, well, you're just being difficult, it's just a piece of string. But actually, the change that you'll get from a glove or a different suture can alter the way that you might perform, and that might have significant downstream effects. How you put a laparoscopic trocar, through skin, depending on how sharp or blunt it might be.
But it's particularly more of a challenge when actually you can't prove that a discrete input of money into a particular innovation will have a particular output of money in terms of the finite financial bottom line. So for instance, again, similarly with falls, falls have some discrete costs associated with them, and some of them are less obvious. So I think I suffer from the fact that actually, if our health economic modelling is not sophisticated enough, we end up, like I had to with the pressure offices, is building them all from the bottom up.
The crux of it is, and it keeps being repeated, is the fact you need your frontline staff to be engaged from the beginning. And various pieces of medical devices are brought into ICU will only work if you've got your frontline staff engaged and they do the evaluation and they feel part of it, and you have much better success. That staff are much more educated and they see it from the patient perspective as well.
It was something that we have done at Salford, and as you can imagine, it was.
Choosing his life.
Absolutely, so it was challenging. It was absolutely challenging. But what we had to do is our medical director led that process. So we worked with the suppliers and their supply chain to say, this is all the clinical evidence on these particular gloves. This is the market leader, which we all probably know who it is, and have dominated the market for years. These are the alternatives, and these are the steps we're going to take to work with our clinical workforce to make a step change on those particular products. And that's the only way you can do it, is to do that engagement at a local level and walk them through the process.
I've never experienced or seen a procurement based on patient safety, not in our industry sector or this country.
And we have some experience now with our local innovation hubs of actually evaluating and supporting industry by doing their evaluations of new pieces of equipment to actually see what product there is. So recently we've done one for an Apple stethoscope, where you an Apple otoscope, where you can actually take pictures down a child's ear and transmit it straight to an ENT surgeon, who will then say, I'll see the child in half an hour, or don't worry, it'll settle down. So we've been doing that evaluation. So I think that sort of partnership and collaboration is actually an extremely valuable way to go.
You don't just buy some stuff, you actually procure a partner to work with you and get the full value from that as well.